Nurse Aide Test Prep Handbook. Question 1. A client with a history of COPD should have a target SpO2 of Option A 100%, Option B 94 to 98%, Option C 88 to 92%, Option D 85 to 88%. The correct answer is Option C, 88 to 92%. For clients with COPD and chronic hypercapnia, the target SpO2 is 88 to 92%. This balances adequate oxygenation with avoiding oxygen-induced hypercapnia. The target for healthy clients is 94 to 98%. Question 2. When assisting with meals, the nurse aide should: Option A, place the food tray on the bed. Option B, place the food tray within easy reach on the overbed table. Option C, feed the client immediately. Option D, leave the tray for the client to manage. The correct answer is Option B. Place the food tray within easy reach on the overbed table. The tray should be within easy reach so the client can self-feed if possible, promoting independence. Placing on the bed is unsafe and unsanitary. Feeding immediately may be unnecessary if the client can self-feed. Question 3. What is considered a normal blood pressure for an adult? Option A, 90/60 mmHg. Option B, 110/70 mmHg. Option C, 130/90 mmHg. Option D, 140/100 mmHg. The correct answer is Option B, 110/70 mmHg. Normal blood pressure is less than 120/80 mmHg. 110/70 falls within the normal range. 90/60 is low, hypotension. 130/90 and 140/100 are elevated and indicate hypertension requiring medical attention. Question 4. A client's blood pressure reading is significantly different from the previous reading. The nurse aide should: Option A, ignore the difference. Option B, recheck it after 1 to 2 minutes. Option C, change the client's medication. Option D, document the first reading only. The correct answer is Option B. Recheck it after 1 to 2 minutes. When an unexpected reading is obtained, recheck after 1 to 2 minutes. The client may have been talking, anxious, or the cuff may have been positioned incorrectly. CNAs cannot change medications. Documenting only the first reading without confirming would be clinically incorrect. Question 5. When dressing a client with a weak right arm, the nurse aide should: Option A, dress the right arm first. Option B, dress the left arm first. Option C, dress both arms simultaneously. Option D, dress the stronger arm first. The correct answer is Option B. Dress the left arm first. Dress the stronger arm, left, first, then the weaker arm, right. This minimizes discomfort and strain on the weak arm. Dressing the weak arm first would require moving it more. Question 6. A client is in the active dying process. The nurse aide should: Option A, avoid the client. Option B, provide comfort measures. Option C, stop all care. Option D, leave the client alone. The correct answer is Option B, provide comfort measures. Comfort measures such as repositioning, mouth care, and emotional support are essential at the end of life. Avoiding or leaving the client alone is not appropriate. Stopping all care would be neglect. Question 7. When weighing a client, the nurse aide should: Option A, weigh the client at different times each day. Option B, weigh the client at the same time each day. Option C, weigh the client after meals. Option D, weigh the client before toileting. The correct answer is Option B, weigh the client at the same time each day. Weighing at the same time each day, example before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 8. A client who is agitated and wandering should be: Option A, restrained to ensure safety. Option B, redirected calmly to a safe area. Option C, left alone to tire out. Option D, given medication to calm down. The correct answer is Option B, redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication. Question 9. Which approach is best for a client with dementia who becomes agitated during personal care? Option A. Use a firm tone to assert authority. Option B. Provide simple explanations and allow choices when possible. Option C. Complete care quickly regardless of the client's response. Option D. Skip the care altogether. The correct answer is option B. Provide simple explanations and allow choices when possible. Simple explanations and offering choices. Example: would you like to wash your face first or your hands? Reduce agitation and maintain dignity. A firm tone can escalate agitation. Skipping care is not appropriate. Question 10. When communicating with a client with dementia, the nurse aide should: Option A. Use complex medical terms. Option B. Use simple, one-step directions. Option C. Speak loudly. Option D. Ask open-ended questions. The correct answer is option B. Use simple, one-step directions. Simple, one-step directions, example, please sit down, are most effective. Complex terms, open-ended questions, and loud tones are overwhelming and may cause agitation. Question 11. A client with dementia becomes combative during a bath. The nurse aide should: Option A. Finish the bath quickly while being firm. Option B. Stop and try again later when the client is calmer. Option C. Restrain the client to prevent injury. Option D. Leave the client without finishing the bath. The correct answer is option B. Stop and try again later when the client is calmer. Forcing a bath on a combative client escalates the situation. Stop, assess the cause, and attempt later with a gentler approach. Restraint should only be used with an order and as a last resort. Question 12. To prevent aspiration during feeding, the nurse aide should: Option A. Feed the client lying down. Option B. Feed the client with their head tilted back. Option C. Feed the client in an upright position. Option D. Feed the client only pureed food. The correct answer is option C. Feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 13. After giving a client a back rub, the nurse aide should always note: Option A. The last time the client had a back rub. Option B. Any change in the client's skin. Option C. The client's weight. Option D. The amount of lotion used. The correct answer is option B. Any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document. Question 14. The nurse aide should document care. Option A. At the end of the shift. Option B. As soon as it is completed. Option C. Before providing care. Option D. Only if the client's condition changes. The correct answer is option B. As soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 15. A client with depression refuses to get out of bed. The nurse aide should: Option A. Allow the client to stay in bed. Option B. Gently encourage the client to get up. Option C. Force the client to get up. Option D. Call the family to get them up. The correct answer is option B. Gently encourage the client to get up. Gentle encouragement with support and assistance can help the client participate in care. Allowing them to stay in bed may worsen depression. Forcing them is not appropriate. Family members should not be expected to manage care. Question 16. When assisting a client to walk, the nurse aide should walk. Option A. Behind the client. Option B. Next to and slightly behind the client, holding the gait belt. Option C. In front of the client. Option D. Far to the side of the client. The correct answer is option B. Next to and slightly behind the client, holding the gait belt. Walk next to and slightly behind the client on the weaker side, holding the gait belt to provide stability and catch them if they lose balance. Walking behind doesn't allow seeing the client's face. Walking in front is unsafe. Question 17. The nurse aide is assisting with morning care. The client prefers to perform their own care. The aide should: Option A. Perform all care for the client. Option B. Allow the client to do as much as possible independently. Option C. Rush the client so they finish quickly. Option D. Leave the room and return when the client is done. The correct answer is option B. Allow the client to do as much as possible independently. Promoting independence is a core principle. The nurse aide should encourage and enable the client to perform as much self-care as possible while providing assistance only where needed. Performing all care undermines the client's abilities and dignity. Question 18. A client is bleeding profusely from a wound. The nurse aide should: Option A. Apply direct pressure to the wound. Option B. Apply a tourniquet. Option C. Elevate the wound. Option D. Apply ice. The correct answer is option A. Apply direct pressure to the wound. Direct pressure with a sterile dressing is the first step to control severe bleeding. Tourniquets are for life-threatening bleeding not controlled by direct pressure. Elevation and ice are not as effective. Question 19. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A. Rubber sheet. Option B. Air mattress. Option C. Emesis basin. Option D. Restraint. The correct answer is option B. Air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 20. Normal adult resting heart rate range is: Option A. 40 to 60 beats per minute. Option B. 60 to 100 beats per minute. Option C. 80 to 120 beats per minute. Option D. 100 to 140 beats per minute. The correct answer is option B. 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 21. Normal adult respiratory rate is: Option A. 8 to 12 breaths per minute. Option B. 12 to 20 breaths per minute. Option C. 16 to 24 breaths per minute. Option D. 20 to 28 breaths per minute. The correct answer is option B. 12 to 20 breaths per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. Rates below 12 indicate bradypnea, above 20 indicate tachypnea. Both require reporting to the nurse. Question 22. A client's oxygen saturation reading on the pulse oximeter is 95%. This is: Option A. Below normal. Option B. Normal. Option C. Above normal. Option D. Requires immediate reporting. The correct answer is option B. Normal. Normal SpO2 is 95 to 100%. A reading of 95% is at the lower end of normal but is acceptable. Readings below 90% require immediate reporting. Question 23. When receiving a report at shift change, the nurse aide should: Option A. Ask questions about unclear information. Option B. Write down everything quickly and leave. Option C. Ignore information about client preferences. Option D. Rely on the previous aide's verbal report only. The correct answer is option A. Ask questions about unclear information. Asking questions ensures accurate communication and safe care. Writing everything down without clarification may lead to errors. Ignoring preferences misses important care details. Question 24. A client with a pulse of 112 beats per minute is experiencing Option A, normal heart rate. Option B, bradycardia. Option C, tachycardia. Option D, arrhythmia. The correct answer is option C, tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 25. When applying a gait belt, the nurse aide should place it. Option A, around the client's chest. Option B, around the client's waist, over clothing. Option C, around the client's hips, under clothing. Option D, around the client's neck. The correct answer is option B, around the client's waist, over clothing. A gait belt should be snugly around the client's waist, over clothing, not bare skin. Not over the chest, restricts breathing, not under clothing, skin irritation, and never around the neck.